Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Heartburn and gastric pain, these have been annoying to millions of people all around the world lately, and it's been an increasing problem for them. Is it the types of food that we're eating? Is it the way we eat our food? Or is it something else? Today with us is Dr. Muhmmad, Anwar Sulaiman, consultant of Gastroenterology and Hepatology, Cairo University, Egypt. Welcome, Dr. Muhammad.
Oh, thank you. Thank you.
What's the problem? What makes us having a heartburn, a gastric pain, and it's been increasing? Is it the fast food that we're eating? Is it the way that we eat the food? Or what is it?
It is a problem. It is a big problem, actually.
Yes.
And it could be all these things that might lead to what we call the heartburn, you know?
Yes, exactly.
The heartburn is just the symptom, you know, and under this symptom could be a lot of things that lie underneath, you know. Could be what we call the GERD or the gastroesophageal reflux disease. Could be the peptic ulcer, the well-known famous peptic ulcer.
Yes, everybody is having peptic ulcers these days.
Yes, yes. It's very common, you know, and the GERD, what we call the gastroesophageal reflux disease, which is because it is very common, sometimes they don't call it a disease, you know, because each of us at the time it has experienced the GERD in a variable degree, you know.
Really? Yeah.
Definitely. If you just think about it, or you ask most of the people you know, they will just tell you that, yes, we had a heartburn one day, or like many times. It all depends about what we eat, what we take for our treatment, for our medications.
Yes.
And sometimes there's another thing, another famous thing that we call the Helicobacter pylori, or the H. pylori. That was the hidden factor behind the peptic ulcer. And this was discovered a few years ago. And the scientist who discovered this bacteria has been given the Nobel Prize for discovery of this bacteria.
You mean the peptic ulcer is caused by an infection?
It could be, yes. About 80% of patients who are having peptic ulcers are having this type of bacteria, the H. pylori or the Helicobacter pylori, which is a spiral bacteria present in our stomachs and leads to the development of the disease.
Quite interesting. So would you tell us more about what's a peptic ulcer?
An ulcer is simply it's a disruption or the discontinuity of the mucosal covering of our gastrointestinal tract.
That's the lining of the stomach.
Exactly.
Yes.
Simply this discontinuity or disruption is an erosion that usually about ½ centimeter in width. Okay. Usually this happens in acidic medium. You know, like in the stomach.
Yes, there is an acid in the stomach.
Of course there is. Yes. Yes. So, as we just mentioned, the H. pylori is present in about 80%, and the H. pylori loves living in the acidic medium. And this makes it flourish and grows, you know, and leads to further damage of the mucosal lining of the gastrointestinal tract and the development of the disease with its consequences. And this will lead to the development of symptoms.
Yes. And
we have a lot of symptoms of this disease. And some patients or some persons do not experience any kind of symptoms. And the first time of discovery of the disease in some people is just bleeding. They might reach the point of bleeding without even feeling a problem.
Without a prior pain.
Of course.
So before we go to symptoms, I would like you to tell me, you said 80% is caused by an infection of the H. pylori.
Yes.
And that's quite amazing.
Yes.
So it is the biggest factor of causing the problem. But is it the only factor?
It is not the only factor. And by the way, it is very easy to diagnose the presence of H. pylori. We can just diagnose it through the feces, you know, just a sample, stool analysis, or just a blood sample, or sometimes the breath that comes out. We could just analyze it.
The smell of the breath.
Yes, with just the air that we expel, might diagnose the disease. Or sometimes we resort to an endoscopic diagnosis by taking a biopsy. Okay? And other factors might play a role, like some medications, like the aspirin or what we call the non-steroid and anti-inflammatory drugs might have a role as well. Or what we eat.
Yes, what we eat is a problem.
This is an important issue.
Is it what we eat or how we eat it?
It's both, actually. Yes. What we eat, because, junk food these days, and the fast food, and the greasy food, and the breaded things, and the oil, like the use of a large amount of oil and fats and butter, and all these things might have a role. The spicy food, the excess of spices that we might use, the excess of citrus drinks, and all these might, if they will not be the single reason, they might worsen the condition or be a reason among other important reasons.
The soda, is the soda one of the problems?
Yes,
our children
especially
drink,
if we are having an abnormal mucosal lining. It could be, yes. Could be, yes. And I always say that instead of drinking, I'm not against soda, by the way, but instead of drinking soda, which is at the end of things, it's like sugar and soda, we might drink some beneficial things, like fresh juice or something that might have like minerals and vitamins and a lot of things,
Exactly, yes. So, you said the way we eat.
The way, yes.
Yes, how is that?
Because if we stick to the 3 main meals, not in large amounts, and we just try to take a light snack between like breakfast and lunch, and between lunch and dinner, this is an important thing. Because most of us, unfortunately, we stay fasting for a long time because of work, because of the daily routine or whatever, and then we just eat a huge meal after a long time of fasting.
That's true.
This is totally wrong. Another thing that most of us just eat this large or huge meal and then go directly to bed.
Yes,
this is another mistake. This is another mistake. More important is how we eat. I mean, the time that we should take our time in eating.
Nobody has time these days.
You should,
Yes.
because you should give your time. You should give yourself the time to, enjoy it. First of all.
That's true.
Because the process of digestion starts from your mouth. Just swallow well. This will help. And then eat a balanced meal. When we say the balanced meal, the meal that contains all the important ingredients. It's like proteins. It shouldn't be an animal protein. It should be could be a plant protein, like beans or whatever. It's like some vegetables, some carbohydrates, in a balanced manner, in an average amount. And please never, this is for our distinguished viewers, never sleep immediately after your meal. And try to take small, frequent meals.
And people who would drink and eat while walking or standing, this would cause an impact of the food on.
Of course, I just told you, we should try to enjoy our meals.
Yes, sit down and relax.
Exactly.
And eat your food with an enjoyment.
Yes, and eat your healthy food while you're enjoying it.
And many people would like to mix many kinds of ingredients in the food. As we know, the Prophet sallallahu alaihi wasallam, he used not to eat more than 2 types of food in one meal.
Yes.
Yeah.
Yes, it is right. It is right. Because, as you just said, and the Prophet Muhammad said, مَا مَلَأَ ابْنُ آدَمَ,
yes.
It's like, it's both are relevant, because if you just mix foods, different types of food, you're making things, more harder for your digestive system to act. You need a lot of digestive enzymes and hormones, which is render the person having difficulty, and we develop what we call the dyspepsia.
Yes.
Yes.
So it's known that the peptic ulcer is mainly located in the stomach, as we all know. And
surprisingly, this is not right.
It is not right?
No, it is not
so
right.
Where is the peptic ulcer?
Most of the cases are in the duodenum, which is the first part of the small intestine.
That's outside the stomach?
It's exactly.
But we
Just
don't have...
this is the first part after the stomach.
That's the most common part.
Yes.
But we do have some ulcers in the stomach.
We do have, and the stomach is very important because about 4% of the ulcers that develop in the stomach might turn malignant ulcers, might lead to cancer. So this is the importance of the stomach ulcers. And maybe this is why it's very common that people say stomach ulcers, stomach ulcers.
Hold on. You're saying the ulcer is not just a problem of pain. It could change into a malignancy.
Yes.
That's quite interesting.
Unfortunately, yes. Yes. This is why we should not take it lightly. We should stick to the right diet. We should treat ourselves right, and we should follow up with our doctors regularly.
So, what other areas in the GIC that would have an ulcer?
We can have an ulcer in our esophagus.
Just right up to
yes,
in the esophagus.
We can have an ulcer in any part of the gastrointestinal tract might develop an ulcer. We can have an ulcer in the small intestine, what we call the Meckel's diverticulum, and the distal part of the small intestine, what we call the ileum, the distal part of the ileum. We can have an ulcer there. Meckel's diverticulum is a congenital diverticulum that was discovered by scientists long time ago. It's like in the 17th century. It's not 1809 or something. And we can have an ulcer on top of this congenital problem.
That's quite interesting, actually.
Yes. We can have an ulcer in colon, by the way.
Oh.
Yes.
So we can have an ulcer anywhere.
Anywhere in the gastrointestinal tract.
That's really interesting, and we should see a picture of... You have a picture of the ulcer.
I do have pictures, yes.
Okay, so, dear viewers, we'll be back after the break with pictures of peptic ulcer and more about peptic ulcer and how it looks like and how to treat it. So don't go away. We'll be back, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
You know, sometimes it's important to take a break. We need to take a break. Take a break from what? From the everyday things to look at what we're really doing as Muslims. That's why we said we really need to have this program for you and for me to take a break right here on Huda TV. Stay with us because we've got a lot coming up on Take a Break.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health. And our topic today, as we've been talking about the peptic ulcer and the heartburn, Dr. Muhammad, you've been telling us about the symptoms. Some of the patients get pain, get reflux, get heartburn. Others would not experience anything until they have a major catastrophe like bleeding or something like that. That's a great variation between the symptoms. So, would you tell us more about the symptoms? It seems to be very interesting.
As you just mentioned, some patients or some persons might have nothing at all. You just present with a serious problem like bleeding or a perforated ulcer. This is a rather important, serious thing.
A perforation of the ulcer.
A perforation, yes.
You mean it goes all the way to the other side?
Exactly.
The whole thickness of the stomach, or the area which is affected?
The stomach or the duodenum or whatever.
Yes.
And this necessitates an immediate surgical intervention. The patient should go directly to the operation, to the operating room, you know.
All of a sudden, he doesn't have anything before, and he has to go into the operation.
Exactly.
That's quite...
Exactly. Or he might have bleeding, as you just mentioned, yes. Or in the common form, he might have just an abdominal pain, usually what we call the epigastric pain. Classically, this pain is about 2 or 3 hours following meals. And in duodenal ulcers, this pain might be improved by eating meals. And on the contrary, the stomach ulcers, the pain will worsen after getting a meal. So this could be a a way to differentiate, which is not always like this, but it could be a way to differentiate between duodenal ulcer and a gastric ulcer.
Yes.
Another thing that the patient usually complains of nausea and sometimes vomiting, which could be a large amount of vomiting with a large frequency, like he might experience it a lot of times per day with a large amount. Okay, he might have in some occasions what we call the hematemesis, or the bleeding, as you just mentioned.
Mm-hmm.
Either he just vomits blood, or sometimes we might have what we call the melena. Melena is simply the passage of dark, tarry stools. And it is because of the digestion of blood. The iron, the oxidized iron present in the hemoglobin of blood, leads to the passage of this black, tarry, dark stools. Black, tarry, offensive, dark stools.
Yes.
So this is another alarming sign that should draw our attention to the presence of a serious problem that needs an immediate interference. Okay?
Mm-hmm.
So we'll show some pictures here on the screen for a duodenal ulcer.
Yes, you promised us to see.
Yes.
And we promised our viewers to see how the ulcer looks like.
This is the duodenal ulcer. The whitish area is an ulcer, surrounded by an inflamed mucosa, and on the top this is more or less a normal mucosa. Another picture is for the gastric ulcer, a benign gastric ulcer.
A benign one.
Yes, a benign one.
Yes.
We can see around the normal mucosa, what we call the rugae of the mucosa, and in the middle, just in the middle, the ulcer.
Yes.
Down in the picture, this is the malignant ulcer. We can notice the difference in size and the depth of the malignant ulcer from that of the benign one.
These pictures are taken from the endoscope.
Yes, yes.
This will lead us to how to diagnose and how to know the site and the size and the shape of the ulcer.
Yes. In the past, they were using the barium studies, what we call the barium studies, using the X-ray machines. But with the development of endoscopes, at the beginning they were the fiber optic scopes, and now we have the video scopes, and every day there are some more developments on the types of endoscopes that facilitates and helps in the diagnosis of all the diseases of the gastrointestinal tract, and on the top of these diseases, the ulcers.
The ulcers, yes.
We just simply watch and see the ulcer directly with no possibility of mistakes. You just see, and you see it clearly, and sometimes if you need some other modalities like what we call the narrowband imaging, or a lot of things that help ensuring the diagnosis and differentiating between types of ulcers. Sometimes, especially in cases of stomach ulcers that we mentioned, because as we just said, that about 4% of the stomach ulcers might turn malignant.
Yes.
And this leads us to an important thing, that whenever a doctor finds a stomach ulcer, he should take a biopsy or multiple biopsies to make sure that this ulcer is not a malignant one. Moreover, the follow-up of this ulcer is an important thing. We should give the patient an intensive treatment, and he should be committed to this type of treatment. And after that, we might need another look with an endoscope to make sure that the ulcer has been cured, to make sure that this ulcer is not the malignant one, or the treatment that we gave is the right treatment and the patient is cured.
Telling us about the ulcers turning malignant, if we have millions of people having ulcers, that would put the people in a stage of being anxious, of having
Let me clarify something.
Yes,
we just
please.
mentioned at the beginning that most of the ulcers are in the duodenum. And this is because, alhamdulillah,
Alhamdulillah.
the minority of ulcers that develop in the stomach, we didn't say that all the ulcers in the stomach are malignant. We just said it's only 4%. Okay?
Yes.
So what we need is give the right treatment, and before giving the right treatment is to diagnose at the right time, give the right treatment, and stick to the follow-up. These are the more the most important three things.
Yes.
Okay.
Many of those people who would have a heartburn would think that taking milk, taking yogurt, would just calm down the heartburn, and eventually they don't have this this effect. Why is that?
This is a wrong belief in most of the cases. We always advise patients just take a balanced meal. I mean,
Yes.
Milk products should be taken in the regular amounts. Do not take extra amounts of milk products, whether we're talking about milk or yogurt or cheese or whatever. Of course, some processed cheese might even make the condition worse.
The cheese.
Yes.
Yes.
Processed cheese. Okay. Extra amounts of milk and milk products might worsen the case as well. The patient might feel some sense of relief immediately after taking the milk or the milk product or the yogurt.
Yes. That's why
later on, this will lead to worsening of the condition. So we just advise patients, just take a balanced meal, avoid citrus food, avoid spicy food, avoid aspirin and painkillers, avoid oily and greasy food, and please take a balanced meal with small amounts, and avoid, as you just mentioned, mixing different types of food, because this makes things harder.
Yes. So, when somebody gets the ulcer, and he's diagnosed that he has an ulcer, it could be either there is an infection, as you've mentioned early in the episode, it's caused by the H. pylori,
yes.
or it could be some other reason. So, what usually the patient should expect to be done for him? What would the doctor do? Would it be dealt with an endoscope?
First of all, as we just mentioned, is the endoscopic diagnosis, and following the endoscopic diagnosis is whether to decide whether this is because of the H. pylori or not. And this is very simple, as we just mentioned. Accordingly, we give the treatment. In case of H. pylori, we might need the combination of 2 types of antibiotics together with what we call the PPI, or the proton pump inhibitors, which are types of medications that prevent the production of acid. It's a big family with 5 members.
Yes.
And each member developed after another, and now we have the PPI family. Before the PPI family, we used to have different types of treatment, what we call the H2 antagonists, or earlier the antacids, and all these are used for the treatment with a different regimen according to the condition, according to the doctor's advice, according to the underlying factor, and the dosage varies according to the condition, according to the response of the treatment.
Yes. So, how long would this treatment, I mean, if we've taken antibiotics for the H. pylori, how long do we expect to eradicate the infection?
Eradicate, this is an important expression, because we call it eradication therapy.
Yes.
And another term is the triple therapy, because it's triple because of 2 antibiotics. We might mix clarithromycin with amoxicillin, or metronidazole in some occasions, together with the PPI. Usually we give the antibiotics for a couple of weeks.
A couple of weeks?
Couple of weeks for the antibiotics.
That's most probably satisfactory.
Yes, but sometimes
bacteria.
we need the PPI for a longer time. Or for the antibiotics, a couple of weeks would be enough.
The PPI
for
would
the
control the
eradication.
acidity of the stomach?
I'm sorry?
The PPI would control the acidity of the stomach? Yes.
Exactly. This is the major role of PPI. And, because of the common use of the PPI, sometimes they are called the OTC drugs. They are among the OTC drugs, over-the-counter drugs. You can just get it without a prescription. Sometimes take it, at the very beginning there was some concerns about the prolonged use of PPIs and the consequences of this. But later on, some research has proved that you can take it for a quite long time. Sometimes it could be taken for a year, a whole year. Can you believe this? A whole year.
And there is any adverse effects for having such a drug for a long time, like a whole year?
It might lead to yes, sometimes it might lead to serious problems. But as I told you, it's as long as we're sticking to the right time, a year. I mean, like not really long. It's like month or a couple of months, and then we can take it when needed, and in an interrupted manner. It won't be harmful or.
It has to be, even though it's on the shelf in the pharmacy, it has to be always under the control of the physician.
Exactly.
Yes. I know many people who are suffering of peptic ulcer. They cannot even sleep. They have to be sitting while they're sleeping. It's a serious problem. Dr. Muhammad, thank you very much for shedding a light on such a problem that many people are suffering from.
Thank you. It was a pleasure. Thank you.
Dear brothers and sisters, thank you very much for having us today with you. We hope we gave you a good idea about how to manage such a problem. We hope to see you next time. Always send us your emails. We'll be waiting for them on health@huda.tv, and our website is huda.tv. Until we meet next time, have a healthy, happy life, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.